If you worry about your health a lot, someone may have told you that you were a hypochondriac. But did you know that hypochondria or hypochondriasis was until recently a clinical diagnosis that appeared in the Diagnostic Statistical Manual of Mental Disorders? More recently, it's been split into illness anxiety disorder and somatic symptom disorder. To know whether you have an anxiety disorder, it is best to get a formal diagnosis from a mental health professional. But here is a quick test based on DSM-5 that will give you a good indicator whether you meet the criteria for illness anxiety disorder. Answer yes or no to the following questions. Question 1. I am preoccupied with having or acquiring a serious illness. Question 2. I have a high level of anxiety about my health and I am easily alarmed about my personal health status. Question 3. I perform excessive health-related behaviours, like repeatedly checking my body for signs of illness. Or I have maladaptive avoidance behaviours. For example, you might avoid going to the doctors or hospital for fear of bad news. If you recognise one or both of these behaviours, answer yes. Question 4. I've been preoccupied with illness for more than 6 months. No, this could just be one illness, or the illness that you worry about may change over time. If you have answered yes to all 4 questions, then it is very likely that you meet the criteria for illness anxiety disorder. However, there is a very similar disorder that I mentioned earlier called somatic symptom disorder. With illness anxiety disorder, there may be no physical symptoms present, or if there are, they are usually mild. With somatic symptom disorder, there are one or more physical symptoms present, and the symptom or symptoms are usually distressing enough to disrupt daily life. A common somatic symptom is pain, but other symptoms could be fatigue or breathing problems. Whether it is somatic symptom disorder or illness anxiety disorder, CBT is an effective treatment for both. Ideally, you should seek support from a therapist, but if you can't afford or access therapy, you can learn the principles and tools of CBT from my channel. Check out my health anxiety playlist here.